You know that sound. It's time for Insurance 101 with Sovereign Select. Well, every day 10,000 baby boomers turn 65. If you're one of them, then there's something you should be doing right now to make sure that you're covered. Tom Qualley is the CEO of Sovereign Select, an independent insurance agency that offers plans from many different companies. Good to have you here, Tom.
Good morning.
Love seeing you. All right, so 10,000 people every day are turning 65.
Isn't that
They're
crazy?
new to Medicare. It is crazy, and
That's
I
a
think
lot.
they're confused. They don't know what to do. What do you suggest for these people?
Well, yeah, some people are confused. Some people just need a resource of, hey, I need some refining of what I think to understand, because there is so much information out there. You know, I hear it all the time. They come in, I have, you know, my kitchen table is stacked with mail. You know, so I usually suggest just move the garbage over, slide that all into the garbage, and call us.
Really?
Absolutely.
That's freeing, I'm sure, to people.
It's really nice. I mean, well, you know, all those mailings and all that solicitation that people get, you know, we're a broker. So instead of calling all those pieces of mail and saying, hey, what do you have? What do you have? What do you have? And then trying to compare them all yourself, call Sovereign Select, because as a broker, we have all of those products and can compare them side by side, all in one shot.
Well, I think what's so important is, too, you listen to people and find out what's important to them. Is it their prescription drugs? Is
Correct.
it, you know, a certain hospital or doctor that they see? What is it?
Yeah.
And then you truly help them narrow down the field as well so that they're not so overwhelmed.
Right, and we focus on a customized solution for each person, because really it's not a one-size-fits-all system. Medicare is very structured in a sense where the federal government and the state governments really regulate what the products are, how they work. So most of the products work pretty much the same, but there's little variations in there that work for each person differently. So like you said, it could be their health needs, their prescription needs, financial needs, could be just the location that they live.
Right.
And the time, it could be their age, in some cases gender. There's all different factors to take into account when you're planning for somebody, but when you work with a professional, you can really be sure that you get a custom solution specific to your needs.
And I love it because people don't pay you for this process.
Correct.
You get paid by the companies, so they're not shelling out of pocket for your help.
Yeah, and you know, the government also regulates the commission. So,
Yeah.
you know, we're not beholden to any specific insurance company because, oh, we're going to sell this product because we
That's
get
good to
paid
know.
more. You know, so it doesn't really matter which product the person, you know, chooses to us. It really doesn't matter. So really, we want to make sure that we custom fit a solution to each individual person that works specifically to them, no matter what company or product it actually is.
That's great. So there's no bias. You're truly just
Right.
helping the person.
Absolutely.
Another way that you help people, and I'm a big fan of this. I used to have a policy. I need to get a new one. Is cancer insurance.
Yes.
A lot of people aren't familiar with it, but it's something important to have. And why?
Yeah, and you know, it can be a tough conversation to have, but it's only a conversation that you have to have one time. And it's a very quick, easy conversation. It can be done within 10 minutes.
Getting a cancer insurance policy.
To even understand what the policy is and if it works for you, and then to actually sign up for a program, it can take 10 minutes.
How much does it cost?
It depends on a person's age,
Okay.
really. So it can be anywhere from $2 a month all the way up to $100 a month, depending on what level of coverage you choose. So the way it works, very simply, it is a lump sum benefit. So if a person is diagnosed with any form of cancer, they would get a check from the insurance company for a lump sum of money that is predetermined.
By how much you choose to pay for the policy?
Correct. So I
Gotcha.
basically call it living life insurance. Okay, so
Absolutely.
you don't have to die to get it. You just have to be diagnosed with cancer.
Right.
Okay. So people can choose anywhere from $5,000 all the way up to $100,000 or more of coverage. So say they're diagnosed, they can get a check for, say, $50,000.
I'm going to tell you right now how important I think that is, because I've told you my best friend was diagnosed with breast cancer. The chemo that she needs is not covered by her insurance. It's
Right.
15 grand a treatment out of pocket.
Yeah.
So had she had this cancer insurance, that money could
Yeah.
have saved her family so much stress. And so I think it's very important.
And the nice thing about it, real quick, is the money can be used for anything. So
Even groceries?
Could be groceries, could be house payments, car payments, experimental treatments, or it could be just used to pay the deductibles and copays and coinsurances under a traditional health insurance plan. I personally bought a plan myself for those very reasons.
I need to call you for that too, because you do my health insurance as well. All right, you've got these great Medicare 101 educational meetings. This is where you can learn about Medicare. They are strictly educational. You don't discuss specific insurance company plans, but you should call to reserve your seat because there is preferred seating and it is limited. So feel free to show up if you can't call to attend, but there's no cost for this educational event. Here's the phone number to call also for a no-cost consultation with Sovereign Select, 262-641-4111. So every Friday at 10 a.m. or call to make your own appointment with Tom or one of his licensed
Those
professionals.
educational meetings are fun, and they're small. You know, we don't want to pack a whole big room of people. We want it small so people can ask questions
Good
and really understand.
Thanks, Tommy.
Thank you.
Good to see you.